first time, we are getting a look at Charla Nash's new face. She is the woman who survived a violent attack by a chimpanzee. This was in 2009, and just a few months ago in May, she received a full face transplant. While some of the images may be disturbing, nobody can deny that her transformation is nothing short of remarkable.
For her to make an expression, something that we've had to take from her words before, it's just nice that her body language can express how she feels.
Charla will remain blind, but she has regained the ability to smell. You will recall what happened to her back in 2009. It was a friend's pet chimpanzee that turned on her. Police shot and killed the animal, but most of her face and hands were ripped off in the attack. She expressed her gratitude in a written statement saying, "I will no longer be disfigured. I will be able to kiss and hug loved ones." Now, Nash isn't the first person to get a face transplant. Back in 2005, a French woman, Isabelle Denois, was the first in the world to have a partial face transplant. She had lost most of her nose, lips, and chin when she was mauled by her dog, so that was the very first one. A more complete face transplant surgery took place in Ohio in 2008. This was the first face transplant in the U.S., and it was this woman, Connie Culp. She became disfigured after her husband shot her face in a failed murder-suicide attempt. Culp had nearly 80% of her face replaced. Now, all three cases are very different from the extent of the injuries before the transplant and also the way the woman looked after the surgery. Face transplant surgery is still a relatively new procedure, and it's still evolving. So we have asked a facial plastic surgeon to join us this morning to talk a little bit about these types of procedures. This is Dr. Stephen Mobley, who is with us from the University of Utah Hospital. Thank you for being here.
Happy to be here.
So how often are they doing these types of surgeries these days?
They're still exceedingly rare, as you accurately stated. The very first one was 2005 in France. I actually heard that surgeon talk about that procedure about a year after it was done and saw exclusive video from the operation. Really quite miraculous. But these are still being done on a very selective basis. They require extensive amounts of teams, harvest teams, teams to sew the grafts into place, specialized teams to help the patient rehabilitate. So they're being done only at very specialized centers in very unique, limited situations.
When I saw the pictures of Charla Nash, I was amazed at how great she looks. In the past, you have seen some of the women who still look wonderful after, and it's such an amazing transformation for them, but her face, maybe you could say, looks more normal than some of the others. Why is that?
If you look at the transplanted patient, for example, the very first one done at Cleveland Clinic, which I think you had video of, her face was sort of just abnormally bulky. But typically in reconstruction, if you're trying to build a new face, you would rather have a little extra material than not enough. Right. So we do tend to err on the side of putting a little extra tissue in there. You can always go back in later surgeries, thin things out, create better contour. If you don't have enough tissue to begin with, that's when reconstruction becomes all the more difficult.
So when do you do the partial transplant and when do you do the full one?
It's been pretty much directed by the original injuries of the patient. For example, the patient in France had just the mouth, nose, and chin part of the face been disfigured. So all that's need to be transplanted. It'll look a little bit more like a quilt work, for lack of a better term, when you just put a part of another face back on. If you can do the whole face, the person's going to look more whole. Scars will be easier to hide. So in the end, the patient could have a possible better recovery.
That's interesting. And now it really helps them function better. Talk a little bit about that, too.
Well, that's critical. I mean, many of the structures that are involved are the nose, the mouth. These are ways that we speak, communicate, swallow, obtain nutrition. So when the lips and nose and mouth are involved, these are not only to make you look normal, but to have normal function. And imagine how it must be to try and interact in society with a severely disfigured face. Clearly, people are treated differently, are going to have employment problems, social interaction problems. So there's a functional aspect as well as a cosmetic aspect.
So is this just one surgery and that's all she'll need, or does there usually come a series of surgeries?
The transplant itself occurs in one heroically long surgery. The person has to be a donor that's suitable, and the harvesting of the tissue and the attachment of the tissue has to occur all in one long operation, sometimes lasting up to 24 hours.
Oh my God.
Patients will then have touch-up surgeries to improve the contour and make them look closer to their pre-injury state.
Oh.